Hi guys, this is Dr. Branwain from All Four Paws Vet Hospital. I just wanted to kind of update you guys. We talked about kind of starting our YouTube channel, and so we were just going to try and post a video and see how things went. This is new for us, but we kind of wanted to just be able to educate clients more about kind of what we do and what life is like, you know, on a day-to-day basis in our hospital. So I just kind of wanted to guide you very briefly on kind of what's going on right now. We have a couple things going on, so I just wanted to talk to you guys really briefly. Right now we are doing laser therapy on one of our patients, and this is Ziggy. Hi Ziggy. So Ziggy knows his name. Ziggy came to us and had a very badly ruptured knee. The cruciate ligament had been torn from playing a lot of fetch and start and stop motions, and he ended up having a TPLO procedure done, which is a tibial plateau leveling osteotomy. He is a very active guy, and so the owners were very interested in a procedure that would get him the best return of function and the least amount of arthritis, which in this case would be that. So Ziggy had his TPLO done about a week and a half ago, and he came in bearing actually no weight on that leg whatsoever, and he had his surgery, and he's staying with us for about a week post-surgery to really be able to focus on intensive, post-op care with icing and twice weekly laser therapy sessions. He's also getting Adequan injections to help his joints, and we know that there is a partial tear in the other knee, and so we want to try and do everything we possibly can to avoid him blowing out that other knee. But we do know that the other knee is bad, and so we're trying to do everything we can to stabilize it until he, is deemed needing or not needing surgery on the other leg. So in this case, he is not wearing goggles because we're really just focusing on that rear end, and he is a little touchy about his goggles. But Samantha is actually just performing the laser therapy on the area of the knee, and the knee is really getting a lot of laser therapy that's focused on one area, which is designed to decrease swelling and also designed to increase blood flow and blood supply so that he gets return of function pretty quickly. He is actually starting to walk on the leg. He is just about, I want to say probably a week to 10 days out, if that. But he's actually starting to walk very well on the leg, and is, he came in non-weight bearing, and Samantha might be able to show us really kind of how he's walking. Hi Ziggy Bear. Hi Ziggy. So he came in completely three-legged, and I apologize if you guys are motion sick from me learning how to do this, but he came in completely non-weight bearing. He was holding that left rear leg up completely, and he had been for about 4 weeks, and it resulted in a lot of muscle mass and a lot of muscle atrophy. And as you can see, we're about 7 to 10 days post-surgery, and he is already bearing weight on that leg because that leg is already more comfortable with him post-implant than it was prior to surgery. So he is doing amazingly well, and at this point we're very happy with his progress, and so he's going to stay with us for the rest of the week, and then we will basically be sending him back home for more treatment with his parents. So we typically do 3 weeks at twice weekly treatments of laser and Adequan injections, and then the owners have the option of basically doing once a week treatment if they want. Our second patient this is kind of just to give you guys an idea. We're about to head into surgery. This is a little patient who has had some prostatic issues. He is about 9 years old or so, and he developed some prostatic cysts from not being neutered, and so at this point we've reached the decision that despite doing antibiotics to treat the prostatic inflammation and infection, really neutering him and removing the testosterone is really what's going to be needed in terms of getting him better and getting that prostate to shrink and those cysts to go away. That is one of the complications with dogs who remain unneutered. Male dogs, as they get older, they do get prostatic enlargement, prostatic cyst, prostatic abscesses, and sometimes prostatic cancer, unfortunately. So in our hospital, we always do pre-op lab work. We have a full capability to run in-house full panels as well as clotting times. So this is kind of, his pre-op blood panel. And then we typically will basically induce anesthesia in our prepping station over here. We use sevoflurane gas only, and the sevoflurane is basically been found to allow them to actually wake up faster. It allows us also better control while they are under anesthesia in terms of actually being able to gain control. If they seem to be too deep, we're able to basically get them back up. So they're not so deep, and so they're at a good anesthetic level. So at this point, we're going to be heading into surgery, and I just wanted to kind of show you guys just a little bit. This is just a trial run. You guys can let us know what you think. But essentially, we're just trying to show you kind of, this is just kind of, how we operate, how we work, the kind of medicine we offer, just so you guys have an idea. I think a lot of people don't really necessarily know what goes on in a veterinary hospital, or, assume that maybe some older medicine or antiquated medicine goes on. It's actually quite similar to a human hospital. In this case, Kirby is our patient, and he is set up, and we have permission from mom and dad to post this, but essentially the patient is then, once he is fallen asleep out in the pre-op area, he is then moved into the surgical suite. In the surgical suite, we always have our patients on fluid support, this is the IV pump, and then we always have them on heat support. This is a bear hugger. It's used actually in human therapy as well, human medicine for heating during surgery, because their temperatures do drop, as do ours. So this is actually a heating blanket. It actually heats underneath. And so we always have the covers over, but Sarah will show you. There we go. So it blows actually hot air from underneath so that the patient basically remains warm during surgery and does not lose body heat. We usually will put blankets on them as well so that we minimize the amount of body heat lost and just really keep the exposed area of surgery that's been prepped and surgically ready. That's the only area we try to keep exposed so we minimize heat loss. And then this is kind of our setup, so just so you guys get an idea in this introduction video. Again, sevoflurane is our main anesthetic that we use. He is intubated, meaning he has a breathing tube just like any human would. And so that way we're able to control how much oxygen and gas is going in to keep him asleep. Sevoflurane is used in people as well. And so he is on a warming blanket. He's got fluids going. He's got IV fluids going. And he's got heat support, which is extremely important in terms of waking up from anesthesia and faster metabolism of the anesthesia. And then all of our patients are fully hooked up to an EKG so that we can detect any anomalies, as well as a pulse ox, which allows us to know, what his oxygen saturation is. It also allows us to know what blood pressure is, because blood pressure is very important in terms of being able to know, when it's actually time to lower the gas, increase the anesthesia. It tells us, basically some very important parameters in terms of how we monitor anesthesia. So all of our patients have a devoted anesthesia technician who is in charge of doing this while we're actually, while the surgeon is doing the surgery. So basically, just like in human medicine, same thing. There is, an anesthesia person who is devoted to monitoring anesthesia, monitoring vitals, And this machine is nice just because it records all of his vitals, and then we're able to actually download them into the paperless system, into the computer, and all of his vitals are recorded, and that way we know exactly what happened during anesthesia. So I don't want to keep this little guy going or waiting too long, and so I'm gonna prep and scrub for surgery, and then this little man will get his surgery done. We're gonna fix his prostate, we're gonna fix those issues, get him neutered, also address some dental issues that he's had ongoing, and then that will be kind of just an intro from us, just so you guys kind of know what we have going on, and we'll check in later. All right, talk to you guys soon.